Hello, good evening. This is John Nampil from the Polytechnic University of the Philippines, taking Master of Science in Computer Engineering. So, welcome again to our scientific paper review, this time titled Utilizing AI and NLP, or Natural Language Processing, to assist with healthcare and rehabilitation during the COVID-19 pandemic. So, just to give a brief introduction, this paper mainly focused on presentation of data from existing studies and existing developments from previous authors. So basically, they have compiled and collected some supporting facts on how they can make us easily understand on what are the contributions of AI and machine language when it comes to the field of medicine. So um, the authors for the research are Jay Carrier. He's from the Department of Electrical and Computer Engineering uh, from the University of Alberta in Canada. Harim Shafi came from the same university as well. Caitlin Brehan, she is from the School of Public Health from the University of Alberta. Kiran Pohar Mahas, Neurosciences, Rehabilitation and Vision Strategic Clinical Network in Alberta as well. Katie Churchill, Department of Occupational Therapy from the University of Alberta. Chester Hall, same with Kira, he's from Neurosciences, Rehabilitation and Vision Strategic Clinical Network from Alberta Health Services, and Maddie Tavakoli from the Department of Electrical and Computer Engineering, University of Alberta. So the goals and objectives of the study are pretty simple. This is for us to provide vision to us regarding the importance of the application of artificial intelligence or AI and machine learning to the medical field, particularly the natural language processing. So this research also aims to highlight the importance and how AI and machine language have shifted and improved the way we deal with medical applications and diagnosis, especially in the middle of the pandemic. So for their methodology, data gathering and techniques, the researchers have gathered multiple related literatures to build their research based on actual existing studies and researches. This is a very accurate technique in presenting the data effects, especially on sensitive fields such as science and medicine, where there is no room for errors. So we all understand that medicine and science, they are like, sisters or brothers and sisters when it comes to the field. And these are very sensitive fields wherein we deal with biology, actual human lives, anatomy. So that's why we mentioned here that there are no room for error. So these fields are very sensitive and very critical. So the approach that they created in conducting this research is very effective, wherein they were able to support the findings of their study and at the same time highlight the importance and contributions of AI ML in different fields of medicine, such as therapy, communications, and diagnosis. So the researchers were successfully able to emphasize and deliver the results that they wanted to share with the readers, regardless if you are an IT person, a medical person, or not even related to those fields. So if you read these articles, you will have a basic understanding on how AI and medicine works together based on the research, and they are explained very well to the point that even though you are not related to these fields or these domains, you will be able to understand and get the message of the actual research. So with the use of these supporting literatures, the researchers can no longer be questioned, as it was based on pure facts and tested information from previous studies and developments. So one of the examples of the application of the AI in machine language is the NLP, or natural language processing. So here is an example that the researchers have provided in their research. So basically these details came directly from their research paper. So when a patient or caregiver phones into the RAL, so RAL is basically a machine language system in Canada, established last 2020. So they use it for patients to contact their therapists through phone, and those therapists will be able to provide support remotely, or not support, assistance or consultation to them remotely, since we are in the middle of the pandemic, so we will be able to assist. They are able to assist the patients and analyze their data, their names, their details, and everything, and provide um, the expected consultation or therapy that they require without the need of an in-person contact. So, clinical notes are entered into an online charting platform by the occupational and physiotherapist. These clinical notes contain key information about the patient, such as their age, location, and gender, alongside detailing the patient's rehabilitation concerns. We propose the use of NLP and ML to assist with analyzing the information contained in these clinical notes. The call notes consist of unstructured data that can be classified into three categories: historical, including previous patient diagnosis, medication, and existing symptoms. Action taken by the REL advisor during the call, including discussions of the current symptoms, subjective over the phone assessment, and cause of the condition, if it was caused through injury. So, disposition detailing the advice provided or service referrals given to the patient. By capturing this information, the REL provides a means of monitoring and providing assistance to individual patients. So an NLP-ML system has been designed as a case study to analyze the public health impact of the REL, user engagement with the REL, and to provide public health monitoring and prediction of future healthcare resource needs, along with traditional rehabilitation assessment metrics that have been collected during the patient call and surveys. So based on this example, we can see already that REL is an example of an NLP machine learning system. So how it was able to provide the same kind of service, maybe not to the point or 100% the same kind wherein you're in person with your therapist or with your doctor, but it was able to analyze those data wherein you don't need to go to the secretary and fill out the forms and update your data into their database. So this way, with just the use of phone calls, we are able to analyze the patient's data, the patient's condition, and what are the measures that needs to be taken, or the therapy that needs to be applied or that needs to be subjected to the patient based on the symptoms that he has or based on the case that he is having. So from here we can already visualize how AI or machine learning have helped us in this particular field, like for therapists or for patients that needs to see their therapist. So this is only one field of application in the medicine domain. So there can be others such as the normal consultation, follow-up checkups, and etc. So with just one example, we are able to visualize how broad and how big or how many possibilities there are with the implementation of AI into the field of medicine. So here's the example for the RAL. So we have advanced line. That's what RAL stands for. So the call records, the history, the action, and the disposition, then NLP processing and the AI analysis. And then we have here the demographics, the caller categorization, the patient care plan, rehabilitation modeling, and prediction. So this is the some sort of flowchart or visual representation for us to better understand how the rehab advice line works. That was established in Canada, and they are still using it until now. So from the study results, so I haven't cited all of those examples because they are too many on the research, but that is the best example that I saw with good remarks on it. And particularly we are discussing about NLP on our upcoming reporting on our next class. So the study results is that healthcare systems and healthcare delivery have been significantly affected by the COVID-19 pandemic. So with social distancing and isolation policies to continue until new treatment options and vaccines are widely deployed, there is a need to discuss how new and existing techniques can assist healthcare during this challenging time, especially now that we are limiting interaction with each other. So in this perspective paper, we have discussed the use of AI/ML technologies to assist with the assessment, diagnosis, and treatment of acute chronic musculoskeletal, neurological, and other conditions during the COVID-19 pandemic. We have provided examples, like I mentioned, of AI/ML technologies applied to areas such as medical image analysis, robotics rehabilitation, wherein the robot is actually assisting you with your therapy and assessment, and NLP systems, which allows for remote hands-off treatment and assessment of person with acute and chronic conditions. So that is the key takeaway for me, which is the NLP system and how it contributed. So it is a bullseye on the current situation that we have, wherein we are limiting the interactions with each other, with our doctors, with our appointments, right? So it's a very big contribution, and it's a revolutionary improvement with how we live or how we treat our patients or how we interact with our physicians and doctors. So we know that we can apply this more on the said field, and even with other domains such as engineering, technology, businesses, and many more. So they have provided an overview of their ongoing work to help the healthcare system better analyze, quantify, and understand information record during calls to the REL. As further waves to the pandemic are expected, it is important to highlight how using AI and ML technologies can be deployed to provide new public health insights using existing medical history data and new data captured during the remote healthcare sessions. So the study opportunities for these for improvements are: the research is more focused on presenting facts and actual applications of ALML in the medical field. It is also provided applications of ML can be utilized effectively to improve the systems, especially in the middle of the pandemic. I can see that the improvement for this is to provide more studies and actual samples related to those studies, along with presentations and visual aids that can help us understand even those readers with no background in logic, medicine, and information technology. But overall, the research is well written and easy to follow, especially if you have a background on these said fields. Furthermore, the researchers have emphasized to take into consideration some factors that should be addressed, such as the safety and accuracy when using these systems for healthcare data analysis. So we tackle here the data privacy, so the development of publicly available challenge NLP healthcare data sets and better metrics for analyzing the accuracy of such systems in an area which should be worked on any researchers in the future as well. In addition to the accuracy and safety, one other set of factors which should be carefully considered, regardless what field is it, engineering, business, medicine, will be the ethics and privacy and security when using these systems for data analysis, since we are analyzing personal information, personal data. So definitely security for this must be considered in a way that there will be no breach or leakage of personal information of your patients or customers, beneficiaries, etc. So these factors are critical to consider when developing systems which work on identifying healthcare data, NLP systems, for example.